Hey everyone, how you doing? My name is Dr. DeGatano. I am an osteopathic physician. I run a blog at FastPass Medicine. The blog and these videos are going to be about patient education. It's simple stuff. It's just to make you a more educated patient when you go into the office and speak with a doctor, PA, nurse practitioner, whatever. It's not really for any type of healthcare professional. If you are on this and you like it, please continue to watch, but it's going to be a little simplified. First thing I wanted to talk about was Tamiflu. First off, I do work in urgent care. I see a lot of flu. I've been testing a lot of flu lately because we're in the middle of flu season. Usually have a conversation with my patients about Tamiflu. I call it the optional medication. You don't need Tamiflu to get better from the flu. Usually, when you have the flu, you're just going to suffer for a few days and then it should go away. But we do have Tamiflu. I'm not really sure when it came out. It's at least 10 years it's been out. It's an antiviral for the influenza virus. It works against influenza A and B. The benefits of taking it are this. It knocks off about a day of having the flu. So if the flu is going to last you 6-7 days, you take Tamiflu, and it's going to knock it down to about 4 to 5 days. It doesn't really do much for the severity of the flu. So I go over the side effects with my patients. I don't go over every side effect to every medication I've ever prescribed. But because we call this optional, I do feel obligated to tell my patients what you're going to experience. So you're probably going to have a little bit of nausea. I used to tell my patients most people don't have it, but at this point, most people complain to me that they felt nauseous while taking Tamiflu. There's other very rare side effects, and I just wanted to show you. It's on their website. Keep in mind, they're very rare, but they are present. So if you read down here, people with the flu, particularly children and adolescents, may be at increased risk of seizure, confusion, abnormal behavior early during their illness. So we know what seizures are. So anybody that has any kind of seizure disorder, probably not a good idea to take. The next two things, confusion and abnormal behavior, they're a little vague. Confusion, obviously, you're going to be confused, but is it just because you're sick? And abnormal behavior, not really sure what that means. Now, these are very rare side effects. Knock on wood, I've never had anybody complain to me that they've had these. I've only experienced one patient told me that another doctor had prescribed it and they actually were having behavioral changes. But otherwise, most people don't experience them. So I really leave it up to the patients. Do you want to take this and at the risk of these rare side effects and most likely nausea, or do you just want to get rid of the flu on your own? Personally, if it was me, I would choose not to have it. I'm a healthy adult, and if you are healthy, I'd probably say the same thing. You're just going to get over the flu with some supportive therapy. Tylenol, Motrin, and definitely warm fluids. Tea with honey actually helps. Chicken soup actually helps too. If you are immunosuppressed, or if you're very young, very old, it might be something to consider. I've had plenty of patients that take it and said, yeah, not only did it knock off a day, but it kind of worked immediately. So there is some benefits of it, and there's definitely some, disadvantages of taking it. So what I would say is, make your own decision, have your conversation with the doctor that you are visiting. If they say, yeah, take it, then, take this into consideration. So that's really it. Just want to make a really short video. I'm going to try to keep on making some short videos just for patient education again. If you like this video, please give it a thumbs up. And please visit my website, fastpassmedicine.com. Thanks a lot. Bye.